Morning, Franz.
Good morning, Jurek.
I have this singular pleasure of having you here with us and agreeing to chat a little bit on your medical career and your ties with our university and especially with the medical faculty here in Krakow. So, what was it actually that drove you to medicine?
Well, that's actually an interesting story. I decided in the gymnasium to be an architect. And, so therefore I had a maturity type C, which means no Latin. But then all of a sudden, toward the end, just before the Matura, I thought, no, actually, really medicine would be fun. It would be completely different. But then I couldn't go to medical school because I didn't have the Latin requirements, right? So my dad had to fork out money for private tuition for about half a year so that I could learn Latin and do the Matura in Latin. And I was reading Caesar like the newspaper. I mean, within half a year, at that age, you could learn the language absolutely fluently. But you also forget most after the next half year because you never use it. So that's how it went. And then I went into medical school and obviously in Bern, Switzerland, and did my MD right there.
Yeah, and then actually, probably at that time you had the idea of currently practicing in Switzerland, but it turned to be totally opposite.
Yeah, I didn't really have any distinct idea about whether I would practice, whether I would go into academia, but I really decided that it would be fun to do a little research. And honestly, at that time, Bern was a sleepy medical school. There was not much happening. And the restrictions were substantial to do research. So I said, look, why don't I go to America? And I didn't want to go to the US, so I decided to go to Canada. And went to Jacques Chenet in Montreal for about 2.5 years to do a clinical fellowship, which was really, really an interesting experience.
So what did you do there?
Basically, it was a hypertension research position that I had, half in the hospital, half in the institute. So it was what one would say today, translational research. Of course, at that time the term didn't exist, but this is exactly what we did. I mean, we basically looked at the lab and then went to the patient and vice versa. There was a lot of interaction between clinical research and lab research at that time.
So that was actually the pathophysiological approach to the disease and to hypertension, which then turned you to more, as now we style it, the EBM sort of.
Okay. I don't want to bash EBM, but at that time it was pathophysiology, absolutely right. And nobody was talking about these Darwinian outcome trials which are completely stupid when you think about it, because you give a drug to one arm and no drug to the other. At the end, you count the survivors, right? I mean, simply Darwin, who's survival of the fittest. And this is not very intelligent. Now, we used to be, we thought we were very intelligent. We did all these pathophysiology and so on. Now, sometimes, as we have learned now, that pathophysiology was completely nonsense, right? Because the outcome data then showed that we were absolutely wrong.
Like the antiarrhythmics after MI for everyone.
Right. That was the CAS trial, basically showing that, everybody thought, well, ventricular extrasystole is not good to have post-MI. And then they showed you can suppress these with certain antiarrhythmic drugs. So therefore, that's good. So these antiarrhythmic drugs were given to these patients, but the outcome trial clearly showed that these patients were dying at a higher rate, despite the fact that they had less arrhythmias. So, pathophysiology, electrophysiology, not all this tells you exactly what happens in reality. Right?
Yeah. So then you were back from Canada.
I went back to Bern for another year, but already was invited at that time to join the faculty in New Orleans at the Ochsner Clinic. And, after that 1 year, we decided to leave again, to go to the US. We were really not sure for how long. Initially, I thought I would just spend another year or two doing research, but then they locked me in with a good position, a good clinical position, a good research position. So I decided, or my family decided, well, why not stay a little longer then? And I've been in the US 40 years, which is
quite some time.
Quite some time, yeah.
Yeah, and you were following the tracks of the of hypertension and cardiovascular research, and that was a bit later on actually that your collaboration with our faculty started.
That's absolutely right. And the collaboration with the Jagiellonian University, so to speak, started when Tomek Grocicki was coming to New Orleans as a fellow and worked in our lab at that time. We worked together. We actually had quite some substantial publications. He was a very prolific, very creative fellow, needless to say. And, but he only stayed about a year and a half, and then he disappeared back to Krakow. And of course I stayed and continued to stay there. But obviously this created the fundament for collaboration. And we continued to collaborate sporadically over the years, and that's why I'm now basically associated with the university and medical school here in Krakow.
That was also rather gloomy times of the pre-collapse of the previous system in Poland, which is when you were very kind to help us also materially. Like for instance, you were sending some equipment in.
Sure, I mean that was. What should I say? It was a given. I mean, it didn't cost us anything, and obviously, here there was a need for equipment that we wouldn't use anymore because it was outdated, so to speak. In the U.S., everything is outdated after a year or two. Whether it is or not is another question. But that's how it is. I had a lot of money at that time, and so.
With Thomas still with you in New Orleans, you also had this, among other papers, you had this paper. With Goldman, I think, about that actually killed the notion of using the short-acting nifedipine to the blood pressure, which was actually at that time, and still when I was setting my first steps into the field of medicine, that was still the practice of the day.
Oh.
When someone had high blood pressure, give them short-acting nifedipine, and this is going to do the job. Yes, it was lowering the blood pressure, but more along the lines of at zero blood pressure, there's going to be zero risk.
Yeah, I mean, this was actually a very interesting paper. It was one of the most quoted papers that we ever did together with Tomek. You're absolutely right. In the US, standing order on every ward, whether it's psychiatry or gynecology or whatever, standing order, if blood pressure is above 160 over 100, give sublingual nifedipine, but don't wake me up. You don't need to wake me up. You just give that. And that was practice of medicine, not only in the US, but all over the world. Yeah. And we showed that there were absolutely no safety data, no outcome data, and we put about, I think it was 9, 10 cases together where this was fatal and where MI were documented, where strokes were documented. So clearly, the principle of primum nil nocere was violated because blood pressure was dropping You didn't know how much, and some of the patients really had an adverse reaction, and some of them even died. And after we published that paper in JAMA, in the US, within a month or two, the practice came to a complete halt. That's one advantage of the US. The legal system kicks in. You know, if you would have given something on nifedipine after this paper was published, that means a lawsuit, and that means you lose. In Europe, it took much, much longer, as you know, because here you don't have the same legal system in place.
Yeah, that is true. And over the years, the collaboration was still going on. There were chapters on substantial textbooks and papers published, and actually at one moment you received a letter that you were elected for the procedure to receive the honoris causa here. How was that?
This is one of, or I would say the greatest honor that ever was bestowed on me. I mean, this was an incredible honor to, you know, at a university that is 650 years old, finds me and is willing to give me that honor. I was just absolutely flabbergasted. And needless to say, the event here to receive honoris causa was absolutely outstanding. A beautiful, beautiful celebration. So still, I treasure this. This is the greatest honor I ever received in my life.
Well, we are honored as well. So then there was this huge disaster of Katrina in New Orleans, but you managed to leave just before it.
Yeah, that is actually, one could say, one of my wisest decisions in my life. I sold my house, I sold everything, and very simply because I received an offer from, at that time, Columbia University, St. Luke Roosevelt Hospital in New York, and joined the faculty there. That was in 2004, as you said, just before Katrina. And went to New York and stayed in New York for a good 10 years, which, as you know, New York is a crazy place. Absolutely crazy place. But it's also a beautiful place because the culture and Broadway and everything is unique. But it's a good place to visit for a certain time and then to leave and get out of it, right? So that's, you know, very important.
So now after 10 years in New York, it's more Europe than not.
Yeah, I never really lost my European roots. I have to say, I always came back to Europe. I had a house in Switzerland, and I decided, well, I think it's time to go back. And I am now mostly based in Switzerland. I still have the academic appointment in New York, now at Mount Sinai. But I'm teaching at the University of Bern. And of course, I like to come to Krakow now and then. But I'm perfectly happy to be on this side of the ocean because, you know, Europe has certain distinct advantages over the US of A, not to speak of the political issues.
Oh yes, but that's, of that matter we will remain silent, I think.
You don't want to get into this.
Yeah, we are glad to be having this opportunity of having you in Krakow more often than not, and of course we're looking forward to some further projects and continued collaboration, because the collaboration between old friends is not only the profitable thing, but it's also a pleasure.
Well, I'm delighted to be here. And I just want to say, you know, 653 years per se is no achievement. You just sit it out. But what fascinates me here at this place is that it is an extremely lively faculty. A lot is going on, and science is priority. So I'm really, really impressed about, so to speak, a young, energetic faculty that achieves a lot and really does research and teaching and, you know, exactly what should be done.
Yeah, the balance. And there's yet another end to that, because you not only have the interaction with the faculty members or the academic staff, but also with the students, with the undergraduate students, and perhaps worth the while to mention that we are also welcoming the students from abroad, having the English language programs, undergraduate programs in medicine. So, okay, Franz, thank you so very much for the nice chat in the morning, and well, hope to see you again.
I'll come back anytime. Thank you.